Are you having wider earlobe hole? Is your earring slipping off? Is your earlobe sagged? Has your earlobe cleft increased in size? Then this is the must-watch video for you. Hello all, I am Dr. Harish Prasad. I have done my MD in dermatology and fellowship in dermatosurgery. I practice at Vital Skin Clinic, BTM and Electronic City, Bangalore. Ear piercing is done for social, religious and aesthetic reasons. When the ear piercing hole becomes bigger, it is called as earlobe cleft. And for this correction, we do something called as earlobe repair. There are various reasons for torn earlobe. Following are the most common ones to cause earlobe clefts. The ear piercing hole can increase in size as a result of wearing heavy, long and fancy earrings. It can also increase in size due to earrings getting stuck to the pillows during sleep. It can also sometimes happen when the child holding the colorful earring gets down from the mother's arm and tears the earlobe. And during this pandemic, because of frequent usage of mask, the earlobe tears have become common. Earlobe piercing is common in both sexes on both earlobes, while earlobe tear is more common in women. Earlobe tear requires surgical correction to prevent further worsening of the cleft and to prevent slippage of earrings. Earlobe repair is a simple procedure. When done by a qualified dermatosurgeon, recurrence chances are very less. At Vitals, we have a qualified dermatosurgeon who has done many surgeries with very minimal recurrence. Earlobe repair is done under local anesthesia. We give very minimal amount of local anesthesia after a test dose, which makes the surgery painless. At Vitals, we follow a unique surgical process wherein the cleft is freshened by removing thin layer of the skin, and it is sutured back in 3 different layers, which prevents recurrence. At Vitals, we follow an advanced surgical technique which makes the procedure very simple, and the time taken is approximately 15 to 20 minutes per side. Post-surgery, a course of antibiotics and anti-inflammatory medications are given for a week. The suture removal is done after 2 weeks from the day of procedure. With our unique surgical techniques, the healing is faster, recurrence is minimal, making our patients happy. Most of the patients ask for re-piercing, and we advise them re-piercing after 6 weeks from the day of surgery. At Vitals, we have qualified dermatosurgeon and an advanced operation theatre. With our unique surgical techniques, we give maximum benefits to our patients. Are you having earlobe cleft, or you know somebody who is having earlobe cleft and looking out for treatment options? You can contact Vitals Clinic at BTM and Electronic City. Call us on 9206869 610. Thank you for watching this video.